Good afternoon and welcome to today's webinar. I'm Ngozi Lawal from the Center for the Study of Social Policy, also known as CSSP, and I'm delighted to have you join today's conversation supported by the National Collaborative of Infants and Toddlers, a project of the Pritzker Family Foundation. So today we're joined by Alex Citrin, Senior Associate here at CSSP, to share strategies to help those of you working as local early childhood system leaders to partner with child welfare leaders in order to ensure that prevention services are responsive to the needs of young children and their families. So in just a moment, we'll begin the webinar. Before we begin, we have just a few housekeeping items to go over. First, all your lines have been muted, just so we can help keep the background noise to a minimum. But we really do want to hear your questions, your thoughts, and your reflections. So at any point during the webinar, please use the chat box to submit your great questions and thoughts that come to mind, and we'll read those out when there's time at the end. So with that, I'll go ahead and turn it over to Alex to begin.
Great, thanks Ngozi, and thank you all for joining us today as we talk a little bit about opportunities for child welfare and early childhood systems to work together to support a broad prevention continuum. Today, I'm really going to be starting the conversation of an entry point through the Family First Prevention Services Act. It is new legislation that is now really in effect, and states are starting to really move on being able to take advantage of the new opportunities. But beyond Family First, I want to just share a little bit also about strategies for child welfare and early childhood to really think about collaboration and coordination and building a broader prevention continuum. So for today's webinar, and of course now my slides are not advancing when I click on it. Let's see if this works. There we go. The three objectives that I'm going to hope to cover today are one, I'm going to provide a basic refresher and intro on the basics of Family First. Again, some of this may be new to folks, some of it is old news, but just to help us all be on the same page. Going to chat a little bit about how we can use Family First to leverage support for young children and their families, and think about how we can engage with one another to identify next steps within your own community for partnering between early childhood and child welfare. I'll just say, while your lines are muted, please feel free to chat into the chat box any questions you have. I'm going to be trying to monitor that as I'm presenting so that I can slow down and reiterate points and clarify as we move forward. Family First is extremely technical, so I'm going to be trying to provide the right amount of technical information, but also not going too much in the weeds. So hopefully we can hit that balance today. To start off, I want to share this graphic, which is the prevention continuum that we've developed here at CSSP. I apologize, I know that it may not be coming across clear on your screen. This is also on our website. So you can get it on our website as well. I've included the link at the end of this presentation. But what I want to show here and just sort of use to frame this conversation is our prevention continuum and how we support families across the continuum, right? So on the far left, you've got some of your universal resources and services that are available to all families in the community. So universal pre-K, public health programs, stuff like that almost all families will access at one point or another. As you move from left to right across the continuum, you'll see that the types of services and financing streams that are used to support those services become more targeted. So you've got resources available to many, including EITC. As you move down one more, these are specific resources and services available to families with low incomes to help meet basic needs. And then the last two sort of chunks of the continuum there are really targeted services to mitigate risk factors associated with abuse and neglect. And the last one, that bright green, those are really these specific services needed to meet the needs of families involved with child welfare, where the children are candidates for and at risk of placement in foster care. So these new Title IV prevention dollars are really the new dollars through Family First that will be available. Again, these though are very targeted and specific dollars to support specific services. I also wanted to share this graphic. This is from Child Trends that really helps to show the lay of the land in terms of what pots of money are financing child welfare systems currently. You know, the biggest pot here, which sometimes folks doesn't always resonate, is in state and local dollars. So again, this is from 2016. Of the federal funding sources, Title IV-E is the biggest. It's 25% of the broad budgets. And then you've got some smaller buckets, including Title IV-B, Medicaid, SSBG, and TANF. CAPTA, the Child Abuse Prevention Treatment Act, and which includes the CB-CAP grants, community-based child abuse prevention grants, those are bucketed in other federal. So very small part of the broad budget, but just to give folks a sense of what funding streams we're talking about today as we move forward. What's important to know here also when we think about Title IV-E, up until October 1st, Title IV-E was really only could be used for the placement and maintenance of kids who were in foster care. Through the Family First Prevention Service Act, that is, those dollars can now be used to reimburse specific services to keep kids at home in their families with their communities. Again, there are specific requirements attached to those dollars. They have to be considered candidates of foster care, and there are a couple other requirements we'll get into as we move forward. States can begin applying for submitting plans to use Title IV-E dollars for prevention beginning October 1st. That was allowed. The Children's Bureau still has not approved any of the plans that have been submitted. It's important to note, though, along with submitting a prevention plan, a state is also committing to a different change in financing for their congregate care setting, which I'm not going to get into detail about today, but happy to chat a little bit more about that if you have questions. So an overview of Family First, as I've already mentioned, right, this is really the goal of Family First is to keep children at home with their families whenever safe and possible. We know that kids do best in their homes with their families and in their communities. So really this bill finally really brings into alignment what the research tells us with the financing. An important piece, and for folks on the phone who know CSSP, all of our work is centered in equity, and we really think that there's an opportunity here to leverage Family First to advance equity and reduce existing disproportionalities and disparities that we see in child welfare. Families of color are more likely to become involved with child welfare. African American families are less likely to be offered family preservation services, and once removed, children of color experience longer stays and more stays when they're in care. But that being said, while Family First can address those disparities and disproportionalities, implementation there is really key to being able to do so. It will not do it on its own. The new Title IV-E prevention funding that's available, it has to support existing investments in prevention, not supplant them. So what that means is if a state is already funding one of the evidence-based programs that's on the clearinghouse with state dollars, the state will now be able to draw down federal dollars to pay for that, but those state dollars have to also be reinvested in prevention. So really another nod from the feds around the focus on prevention and building out that prevention array, rather than having those dollars go to, say, public transportation or something like that. The bill also prioritizes family-based placements, and it provides new model foster home licensing standards. So when kids are removed and have to be spent time temporarily in foster care, as I mentioned, there are new restrictions on how federal financing can be used for placement in congregate care. There also are these new model foster home licensing standards that emphasize the things that states should be including in their licensing standards and promoting placements with kin. There's also an emphasis on the important role of kin, not only through these foster home licensing standards, but also through the new Kinship Navigator dollars that are available as well. And then I'll just note that a small change within Family First that has not, I don't think, come to the attention of many, but is particularly important to this group, is the required focus within Title IV-B plan to focus on children who are 0 to 5. Again, implementation really is key to success in achieving any of these goals that the bill is intended to support. So talking a little bit, I'm going to focus on the prevention services here. I know that the big buckets for Pritzker are health, early care and education, and family connections and support. And I think there are a lot of ways here that the Family First Prevention Services can support those same goals. And there are also ways that those who are working in spaces around early care and education, for example, can support families who might be receiving some of these services. So again, these dollars for prevention services through Family First are very targeted and specific. The eligibility requirements are that children who are for children who are candidates for foster care, their parents and caregivers, as well as pregnant and parenting youth who are in foster care. The reason that you'll see candidates is really bolded and highlighted here is that means something very specific. As outlined in the Act, this is for children. Candidates are defined as children who are at imminent risk of placement in foster care, but for these services. So we're really talking about here serving kids that are already involved with child welfare. Maybe they've just had an investigation or they're receiving in-home services, and the decision in the past may have been for child welfare to remove, but now that child welfare can provide certain specific services, that child is able to remain in their home. So the types of services that are eligible for reimbursement are all must be evidence-based and fall into one of three buckets: mental health, substance use, and in-home parent skill-based programs. I'll note that the in-home parent skill-based programs don't actually have to be delivered in a parent's home. It can be in the community, elsewhere, but the skills that that parent is learning are then applied in the home. All of these services also have to be delivered within a trauma-informed organizational framework. So that means that the organization that's providing the service has an understanding of trauma and the impact that it has on the lives of children and families, and how children and families may be showing up at the table having experienced trauma. It's not to say, though, that you can use trauma-focused CBT, but not CBT, cognitive behavioral therapy. So just to make that distinction. As I mentioned, all of these services have to be well supported, or promising. There is a new clearinghouse that's been set up by the Children's Bureau and ABT Associates that is rating all of these programs and is continuing to rate programs. There are a number of programs, though, that have already been added: Parents as Teachers, Healthy Families America, and Nurse Family Partnerships, which are already on the list as for in-home parent skill-based program. And there are a number that are still being rated as we speak. I'll also just note that there is slightly different guidance around the evidence criteria for tribes that are operating their own 4E systems. Again, this is recognizing that the majority of evidence-based programs have not been normed on Native children and families. So this allows for adaptation in order to serve those children and families in a culturally responsive way. In order to access any of these dollars, states are required to submit a Title 4E prevention plan that's then approved by the Children's Bureau. I'll also note that while not on this, Kinship Navigator services also are eligible for prevention services reimbursement, and while they do have to be evidence-based, there's different requirements around the proportion that have to be well supported versus supported or promising. Folks may have heard folks in their state talking about that 50% of prevention dollars have to be spent on well-supported services, and that is true. So within the law, 50% of a state's prevention services expenditures have to be on well-supported mental health, substance abuse, or in-home parent skill-based programs. Another piece to note from a financing perspective is that Title 4E is the payer of last resort, so states must bill Medicaid if those services are Medicaid reimbursable first. So when we think about what this could look like in states, it really provides states with an opportunity to implement a broad range of prevention services that can meet the unique needs of children and families. What's critical here, though, is that states are grounding that work, or I should say, should be grounding that work in their data, right? Who are the kids that are coming to the attention of child welfare? Who are the kids with in-home services, open in-home cases? They should also be disaggregating that data by race, sexual orientation, gender identity, and other needs, and need to be thinking about making a strong fit between the approaches and the needs of children and families, right? So thinking about based on the region, based on the different needs of children and families, are you making the right match between the children who have those needs and the services you're implementing? For example, I know that nurse-family partnership is on the list, of course, right? But it is for first-time moms. So states are thinking of implementing that, but they're thinking about using it for pregnant and parenting youth who are in foster care, right? Because that's where you would identify a first-time mom prenatally. That's already known to the child welfare system. So the other thing that I'll note is that while Title IV dollars can only be used for reimbursement of those specific services that are evidence-based on the clearinghouse, we are encouraging states to think a little bit more broadly and based on your data, what really are the needs of children and families, and making sure that you're developing a real continuum that meets those needs. So even if something isn't evidence-based, but it's what matches your population need, how do you ensure that you're financing that and making that a priority and a part of your prevention continuum? So I want to provide a couple of examples here on states that are developing an array of prevention services and how they've done that. So in the district, they've reviewed data, but they also importantly had focus groups to understand the needs of parents and families that way. They looked at all the needs assessment data that they collect. They looked at some of their SDM, so structured decision-making tools, assessments that they conduct with parents and children to really understand the needs. In Arkansas, one of the key things they did was analyze the programs that they had implemented through their waiver to understand what was working and what wasn't, where they needed to build up their continuum of services. A key part in developing this array of services is engaging the community and understanding what are the effective and supportive services out there in the community and where might there be gaps. So again, DC conducted focus groups of parents who've received prevention services and also of direct service providers to understand what's not working, what's missing. All of these states in Colorado, Ohio, and DC, they've got different work groups and subcommittees to engage non-child welfare folks, so folks from their sister agencies from early childhood, Department of Health, behavioral health, Medicaid, to really get a big, broad perspective and investment in what's currently being funded, where are the gaps across the system, and how might the system work together to support children and families. An important part of this work, so we've been doing this work in a couple of different states, and I think a big important part to highlight here is that through these conversations of bringing folks from different agencies together, one thing that we've identified is that from that group, there are recommendations that are coming up around specific Title IV prevention services, but there are also recommendations coming up around what are the gaps in primary and secondary prevention, and how might, now that you are able to use 4E to finance some of these deeper end prevention services, you could use those freed up state dollars, if you will, to push forward and support more broader primary and secondary prevention. So that's been a really interesting part of this conversation, and I think a real key opportunity for early childhood and child welfare to be partnering and thinking about not only how do we serve kids who are at imminent risk of placement in foster care, but how do we even think about supporting and serving children further up in the continuum. The District of Columbia has, for their Family First plan, they've really embedded it in a broader district-wide prevention approach. So they are really thinking about it from that continuum perspective of Family First is a small part of their broader prevention strategy. So as we talked about, through engaging the community and thinking about what are the right matches for services to implement, both for kids who are candidates of foster care, but more broader, it's really important to think about investing in growing the evidence. So we know that only a small number of evidence-based programs have been normed on children and families who are disproportionately involved with child welfare and for whom the greatest disparities exist, and that all of your Title IV prevention services have to be evidence-based. So it's really critical in moving forward to think about ways to build and invest in building that evidence and developing new programs that meet those gaps. So a couple of recommendations and strategies we've been sharing with states are to look to local interventions that work to achieve positive outcomes for children and families, but may not have the evidence to support their outcomes. And think about, how do you build that evidence and develop that evaluation. I know from my own experience in direct practice, we used to say there was this program around the corner. We would say, go to Miss Nancy's. That's the best program. But I'm telling you, Miss Nancy didn't have what she was doing, didn't have a curriculum necessarily. They certainly didn't have the same fidelity measures and evaluation, but we all knew it worked. So think about, in that way, those local programs that you know about that might be working, and you could think about investing in building the evidence. Looking to public-private partnerships are a good way to do that, right? How can universities and your private partners help in developing that evidence? Also, it's important to be looking at communities of color implementing promising and effective approaches. What's coming out of those communities, and where might you make additional investments? As I mentioned, tribes that are operating 4E systems have flexibility in how they adapt and implement evidence-based programs, and it'll be really important to think about what's coming out of those evaluations around what works, and might you implement that in your community. Most states are serving, if not all, are serving Native children, and yet there are only 11 or 12 Title 4E tribal systems, right, serving specific kids. So most tribal kids are actually being served by their state system. So it's really important for states to think about how they look to tribes and implement those evidence-based practices. There also are a number of national quality improvement centers that are continuing to grow data and information and gather information about what works to support different children and families. So I want to talk a little bit about how Family First promotes family-based placements. So for kids who are removed and placed in care, there are really new opportunities to support young children in their families. And again, a new emphasis on that. But first, I'll just note, so many systems, as particularly with the opioid crisis, what we're seeing are kids who are being diverted, and I'm using air quotes for that, diverted to kin to raise them temporarily while their parents get treatment. Now, those kin would be eligible to receive some support and services through kinship navigator services. Again, a real opportunity for early childhood systems to support the organizations that are providing these kinship navigator services to help understand and link young children to quality early child care, right? So if an aunt becomes a caregiver for a young child, they may be accessing the kinship navigator service to figure out, how they do different things. And it's really important that early child care folks have connected with the kinship navigator so that that's part of the support that the kin relative gets, again, to the benefit of that young child. For kids who are placed in care, as I mentioned, there are these model licensing standards that, if states implement, provide more flexibility in terms of licensing kin. So traditional licensing standards can include barriers. For example, kids of opposite gender have to be in different bedrooms for sleeping, or the foster parent and the child can't share a bedroom. Well, if you're a grandmother and you want to foster and provide that care for your grandchild, but you only live in a one bedroom, it would be totally understandable to share a bedroom, right? I mean, if you were a young child going to your grandparents to visit, you might stay in the same room, right? You have the crib or the pack and play next to the bed. So part of the model licensing standards pushes states to think about providing more of that flexibility and waiving non-safety standards for kin. States aren't required to come into compliance with the model licensing standards, but they are required to tell the feds if there is a difference between their standards and the national standards, what it is, and that's it. So, but it is an opportunity for advocates to be thinking there about how do you push your states. The other pieces there around judicial oversight, that's really when we're talking about older youth who might be placed in what are now being called qualified residential treatment programs. So I'm not going to go into too much detail there. Again, happy to answer questions if there's anything that comes up for folks or folks have questions about it. The next piece I want to talk about are these Title 4B requirements. So Title 4B, if you'll remember from one of the first few slides, is a very small pot of money that child welfare systems have to finance different programs. So the Title 4B provides grants for programs directed at keeping families together, either through prevention or reunification if a child has to be removed temporarily. The grants are intended to promote state flexibility, which is really critical here. The children that it's serving, again, could be living at home. These services don't have to meet the same evidence-based requirements. There aren't those same additional standards. They don't have to be candidates for foster care. They could be a little bit further upstream as well. But again, the programs are designed to keep children in their homes whenever safe and possible. And you can also use them to provide training and professional development and support for your workforce. So Connecticut, I know, uses some of their Title 4B dollars to support training on infant mental health for their child welfare staff. One of the key changes through Family First to Title 4B is really, this is a very small technical change. It was like a changing of a comma to really make sure that this meaning was clear, but now it is a requirement that states describe activities to reduce the length of time to permanency for children under 5, and that the state describe activities it's undertaking to address the developmental needs of children under 5. So for folks who are working in early childhood, I would encourage you to be reaching out to understand what's in your state's Title 4B plan. How is your state currently spending Title 4B dollars? And do they have a plan to think about how they do that differently for children under 5? States submit their Title 4B plans every 5 years. So even if your state is in the middle of their 5-year plan, for example, really an opportunity to engage with them and think a little bit more about how they're doing this and how they may want to consider doing it in the future. So I want to stop there and see if there are any questions broadly about some of these foundational elements of Family First. And you can either chat them in or raise your hand, and we can unmute you.
Hey, Alex, while we're waiting, I have a question. This is Erin from CSSP.
Great.
I think you've given some great examples, but I wanted to ask, so I think about like our EC-Link agencies and how some of them are like collaborative or they're like the United Way. Have you about any communities who really didn't have as much, who were in early childhood but like weren't going to meetings with child welfare, or child welfare wasn't like on one of their work groups or anything? Have you dealt with any communities who were trying to establish that relationship and had any really good success stories? Does that make sense?
Yeah, no, absolutely. So I think that, one of the things we think about in any of our system work, right, is how oftentimes they're operating in silos, right? Or it feels like the child welfare agency is just operating on its own. I think a challenging part here, especially with Family First, is that there's been a little bit of, I'll say, rumors in the air that now there's this new federal funding that can be used for any sort of prevention activity. And so folks have been saying, oh, well, let's use that. And it's sort of put folks in the child welfare space, I think, on edge a little bit to say, whoa, that's not exactly what it is. That being said, it really does, though, I think, when you shift the frame to say, how do we support young children throughout the continuum, right? Those who, what does universal prevention look like down the line to more specific and more targeted? When we use that as a frame, how can we all come to the table around that vision? That's been a really supportive vision, I think, for bringing folks to the table when they've really got that as the driving piece. So I think in states that have reached out to their partners, and states that already have some of those relationships, it works well, but reached out to their partners to say, here's our vision, we want us to build this vision together, that's been more successful. I think, in all the states we're working in, we're encouraging them to not just think about their state agency partners, but also their community-based partners that would be good matches for this process and thinking through. And when I say good match, I mean just that they want to be engaged and they have and they want to support the work. So that's something that we've been doing, and we have been seeing more and more states across the country taking that approach. There are a number of states that have public-facing websites, which is also really great to see because it gives the public an idea about what's going on and also opportunities to then reach out and get engaged and see if there are opportunities for engagement. The other thing that I'll just note, one thing that yeah, and the other thing that to note that we've been sharing quite a bit and pushing is that this is not a one-time opportunity for partnership, right? But rather, this is really an opportunity to lay some really good, to solidify those relationships, lay a good foundation for what prevention work looks like moving forward. States can amend their Title IV-E prevention plans as often as they like. So you can continue to add new programs as you build that evidence. And also, as you're hearing from the community about what's working, what's not, and where there might be gaps, child welfare should be continuing to work to address that. So we've really been pushing that this is not a one-time sort of check the box, we did this engagement, but really want to make sure that we're emphasizing to folks the importance of doing it moving forward.
Absolutely. Thank you.
Mm-hmm. So have folks on the phone been involved in planning for Family First implementation in their communities and states? And again, if you want to chat in or raise your hand, we can unmute you. Sounds like maybe somebody wanted to try and share something, but we were getting a little background noise.
So, Alex, it looks like it was Heather and then also Scott Johnson. I don't know if the challenge is that maybe they were both trying to talk together, but maybe we just give a couple more seconds to let them try and speak.
Okay.
And if that doesn't work, Heather and Scott, you could also type in your question.
Yeah, that would be great. And I'll just say the other thing that we've been doing with states when they're thinking about what services are already working, thinking about home visiting programs that they already have in place that have been really effective prevention services as well. I'm getting a little background, which means that maybe somebody's again trying to talk and ask a question.
It might have been just, I was trying to make sure everybody was unmuted to be able to talk. So that might have been the background noise. Sorry.
And Heather and Scott or others on the line, if you want to send a specific question also to one of us on the either Aaron and Gazi or myself, I think you can do that also through the chat box. Okay. So, I think that it's important for folks to sort of think about how they've been involved in implementation and planning, and what might be an effective way to become involved if you haven't yet. The states that are moving forward more quickly, I can just share those with you as well. So the district, Kentucky, Nebraska, Utah, and Arkansas are moving quickly. And there's some additional states that we're expecting will move pretty soon after that. States have between October 1st, 2019 and September 30th, 2021 to come into alignment with the new congregate care financing. So we're expecting that over the course of these 2 years, states will move along the way. As of October 1, 2021, all states will be required to adhere to the new financing for kids who are placed in foster care. So at that point, if a state has not filed a Title IV prevention plan, we would certainly really encourage them to, because you do need to have an approved plan in order to draw down these dollars. So we had a couple questions for folks. Again, I don't know if the chat's working or if the phone's gonna work, but really curious to hear from folks around where else you all are thinking that there is alignment between Family First and the work that you're doing in communities, specific around the Pritzker buckets, and where there might be opportunities for child welfare and early childhood to connect. And what also might be some of the funding streams that could support that collaboration and work. So I'll just share an example of something that we've been talking with folks about. So Nurse Family Partnership is one of the programs that's on the clearinghouse. In some states, it's Medicaid reimbursable, but not in all. So you can imagine in a state thinking about it from a continuum perspective, where a mother becomes connected to Nurse Family Partnership prenatally, is working with the program, and maybe the state is using state dollars to finance it. And then the mom gives birth and the child is born with a positive toxicology. Call is made to the child welfare hotline, and child welfare decides to open an ongoing case and determines that that child is a candidate for foster care, but for services. At that point, you could switch the financing stream for Nurse Family Partnership to Title IV prevention dollars, for example. So that is really a way to think about how one program can support kids all the way across the continuum, but may be able to take advantage of different financing streams. Obviously, ideally, if kids and families are involved with Nurse Family Partnership, they never come to the attention of child welfare. But if that example, for example, were to come into play, it could be a way to braid and bundle your funding as necessary.
So, Alex, we have a comment from Scott, and I think he was trying to speak earlier and had some trouble. So it's not a question, but it's more so, well, I guess it's a comment and a question. So let me just read it. So it reads, I have not been specifically involved in our state's conversations about Family First, but have been paying attention to it and wondering if our work with Dulce might be a fit.
So that's a great question. And actually, one of the resources that we have on our website is specific to Dulce and Family First. And so great question there. Again, there's some pieces of Dulce that are really more primary and secondary prevention, right? And not for kids, and they're being applied prior to kids becoming known to the child welfare system. There may also be times where a child's involved with Dulce and they are involved with child welfare. So a couple of things just to note are around the evidence requirements, and that they have to be on and it has to be on the clearinghouse, and so something to think about. But in the brief, we talk about alignment with Dulce and some of these other financing streams, particularly 4B and CAPTA, to be thinking about how you could leverage state dollars to support Dulce from that perspective. And it's a resource we have on our website. So again, we've listed it at the end of the slides, but if you just Googled like CSSP, Family First, and Dulce, it would come up.
And just so everyone knows, Dulce is DULCE, and it's a medical legal partnership program through CSSP.
Mm-hmm. Yeah. And there are questions, again, so there have been a lot of questions around a Dulce-like program, or for folks who might be, know about the infant toddler court team program through 0 to 3, where that program is serving kids that are still in home but under court oversight, around if 4E could be used to finance and fund that entire program. Great question, and one that we've really done a lot of thinking about. We work with 0 to 3 on their infant toddler court team program as well. And the challenge in funding one of those sort of comprehensive programs is that the programs specific to Title 4E prevention are really targeted, right? So it's that in-home skill-based, mental health, and substance use. So, for example, components of the infant toddler court team program include family team meetings and appearances in front of a judge, right? 4E is not going to pay for the judge's time or necessarily at this point for family team meetings, right? So again, really thinking about how you might braid and bundle different funding streams. 4E does not pay for legal representation when you think about the Dulce model. So how could you braid and bundle funding? Two of the evidence-based programs that have been identified that the Clearinghouse is currently looking at and reviewing to rate are motivational interviewing and solution-based casework. And some states are thinking about, if you train your caseworkers in that model and that they're delivering that in their engagement with families, could you bill your caseworker time in that way because it's a service? So, using the example of the infant toddler court team program, if your community coordinator there, for folks who are familiar with that program, was delivering solution-based casework for kids who are identified as candidates for foster care, you would then be able to bill that part of their time, for example, but not the broader entire program, all 10 core components, if you will.
Alex,
Yep.
Earlier you mentioned in your presentation that according to the data, children of color are less likely to receive family preservation services, that is, services that helps to keep them or maintain them in their home safely.
Yeah.
And wondered if your assessment of the new law helps to turn this around, and is your assessment that this is sufficient, what's in the new law? And if not, is there advice that you have for those on the line in terms of things they can do and ways they can partner with the state for more equitable outcomes in terms of decision making and how resources are allocated?
That's a really great question, and one we've done a lot of thinking about, and it's really, really complicated and nuanced, right? So I will say we've worked with a number of well-intended folks who say, oh, the way to get more family preservation and home services to families of color would be to expand the definition of who can be considered a candidate for foster care. So we know most kids are coming from zip code 12345. Why don't we just say every kid in zip code 12345 is a candidate for foster care? Then we could get these services there. Well, that's really well-intentioned to be thinking about how do you provide services to those communities. The challenge is that families who are receiving one of these prevention services through Title 4E have to be on a prevention plan that is regularly monitored and there are regular assessments of risk and safety. And we know through research that when families are on these plans, there's more over-surveillance and that families go deeper into the child welfare system rather than leaving the child welfare system. So I think from that perspective, there's two things you would want to do, right? You'd really want to think about how can you invest now in child abuse, neglect, and prevention programs in communities where there may be higher reports of maltreatment, so that you're preventing those reports from ever coming, right? And those are not using your Family First dollars, right? That's more upstream, primary, secondary prevention, pushing those state dollars forward and thinking about braiding and bundling your financing. So that's one piece. The second piece I'll add to that is, and I shared this from the beginning, is that yes, Family First absolutely can address those disproportionalities and those disparities, but it will not do it on its own. It really requires leadership and workers, supervisors, managers, all the way up to be organized in a different way where they're recognizing how race impacts families and how structural and institutional racism is bringing families to their attention. So I would say that it'd be great to provide that training to staff, to frontline workers, again, all the way up. So that's one. And two is making sure you're making the right match between families of color and services and programs that are effective and are culturally responsive. So, for example, there is a in-home parenting program that I'm sure folks are aware of, Effective Black Parenting. It is not yet on the clearinghouse, but I can tell you in states that we're working in, they are putting that on, they're going to provide that, they're building that into their array of prevention services because it's the right match for the children and families they're serving. So, to your question, does the law go far enough? Can it address it? It can address it, but implementation is really key. And taking a cross-system, broad prevention vision of that is critical in really meaningfully reducing these disproportionalities and disparities.
Thank you. And we have another question that's come in. It's both a comment and a question. So it reads, such a great opportunity for states to have a coordinated financing strategy for that continuum of services you showed on the first slide. So Alex, maybe if you don't mind going back to the first slide. Yep. And it requires a high degree of state-level coordination to make sure the right kids get the right services connected to the right funding streams. Do you have an example of a state that's getting it right or trying to? So who's the exemplar in your opinion?
First of all, absolutely, totally agree with your comment. And again, we'll definitely want to acknowledge the fact that this is not easy, right? This is not something that is easy, will come easily. It's really going to require a lot of work and intentionality. So in thinking about states that are getting it right, I do think DC is a good place to look because it has been very explicit about embedding the Title IV prevention plan in their broader district-wide prevention plan, and they do have coordination across their agencies. But that being said, I'm sure folks on the phone are going, well, it's DC, it's a little bit smaller, everything's right there, right? It's a little bit different. So, which is absolutely valid. We were doing some work actually just last week in a state that their child welfare agency is county-led. It's state-directed county-led. So there's a lot of variation within counties, and they're really struggling to think about what that's going to look like and how you really maximize opportunities for this continuum when the counties are really taking the lead. And also when you have such variation between your counties, and in some places a regional approach is going to be effective and necessary. Virginia has done some really interesting work in thinking about historically, not that long ago, a couple years ago, when they were working on their juvenile justice end of things, and thinking about how they really developed that continuum and pushed those prevention services into the community. They partnered with their other state agencies in terms of financing. So Virginia, from that perspective, may also be a good place to look. I know in many of the EC Link communities, there's been good local partnership. And so it would also be interesting to think about how have they achieved those goals at the local level and what bubbles up to the state and what would need to bubble up to the state. And I apologize, there is a fire truck or an ambulance going by outside my window that's very loud. So I had a couple key takeaways I just wanted to share, so maybe I can share those, and then if there are any other additional questions, I know we're getting close to the end of the time. I want to be respectful for folks' hour that they've spent here. I also know that going through this Family First and this vision for a prevention continuum is big, and it is can take a while to sort of digest it all. So please feel free to reach out to me either directly or through Erin or Ngazi if you have any follow-up questions or want to talk more specifically about what's going on in your state. I'm happy to set up those conversations as well. So just a couple key takeaways. Family First really creates a better opportunity. It creates an opportunity to better align prevention services across the continuum. I think that's the big takeaway here. It's not just about your Family First prevention services. It's really about leveraging this opportunity to think more broadly across that continuum. Implementation of these services and of these partnerships is really key to system change. From a direct service background and perspective, we know that we talk a lot about we've got to move from compliance to behavior change with families, right? Compliance doesn't mean anything. It's about supporting behavior change to help a family realize and implement their protective and promotive factors to thrive. And I think it's the same in terms of when we think about system reform. Let's not just think about coming into meeting the requirements of Family First, right? Let's not just come into compliance, but really let's think about how do we change the way the system works and functions to serve children and families. There's no silver bullet here. Every state's different. What this looks like in one state is going to look very different in another, right? DC and Montana are going to look very different in how they implement. So just really thinking about what can you learn from your other states and then being creative about what that means for your state. Cross-systems work is essential. There is no way to achieve that continuum of financing and really braid and bundle in an effective way if you're not working with your partners across systems. Again, braiding and bundling is going to be key to supporting any of these services, really in terms of sustainability and in the long run. And I would also just say, be creative. There's a real opportunity to think creatively here about what this can look like. So just a couple key takeaways. And again, just 2 actionable next steps. Engage with your child welfare system around implementation of 4E, and also think about how you can build these partnerships to really leverage opportunities for children before they come into contact with child welfare, those who are involved with child welfare but not at imminent risk, and even for those children who are in foster care, right? If you've established those relationships, it also gives opportunities to think about better supporting kids who are in care. And again, here are some resources specific to Family First that we've developed. You'll see the Dulce piece right there, integrating Dulce into state child welfare prevention continuum. So those there, and then just a couple other pieces that we think really connect to the work of Family First, but aren't Family First specific. So I'll leave the resources up there and open it up again for a couple of questions. I think Marlo has a question.
Yeah. Can you hear me?
Yes. Hi, Marlo.
Okay. Hi. This is Marlo Nash. I'm the National Director of Partnerships and Policy with St. Francis Ministries. And I just wanted to share another state example for the person who asked earlier if there were examples of how states are doing this. We're working deeply in Oklahoma with the Oklahoma Partnership for School Readiness as part of their preschool development grant, Birth to 5 planning process with their federal grant. We helped support and convene an early childhood and child welfare work group that has the Child Welfare Agency, representatives from the researcher community, their Oklahoma Commission on Children and Youth, which is their kind of intersectional child and youth focused agency, and basically just cross-sector representation, the health department, the Department of Education. And as part of the needs assessment that was required by that federal grant, they did an in-depth review to look at children in the child welfare system. And then as part of preparing the plan for the state, we worked in a good number of very specific strategies that can be done that are at the intersection of Family First, and then also thinking more broadly about children in the child welfare system, whether they're in family preservation or if they are in the foster care system, and also how to bridge further upstream from child welfare to secondary prevention to primary prevention. So that state has done really in-depth work, and we have a lot of very concrete examples. And if folks want to contact me, I'm happy to talk more about that and how maybe we could help do that in other states.
Thanks, Marlo. Yeah, I think one thing that's really come out of this is that so we've been working in a number of states where they've come together around Family First, as I mentioned, and then really found that that's been a catalyst for moving forward and thinking about how they do broader prevention. So we were just in a state that is doing this work, and out of this retreat that we had been facilitating, there's a whole new piece that they're connecting now back up to the governor's office and to the trust fund in the state to really think about how they're connecting all of their early childhood work. There's an ongoing commission in that state working on home visiting and recognizing that we've really got to be pulling all of these folks together to do this work in a comprehensive way, because it's all related. And if we're doing it in this way in one place, we really need to be thinking about how we maximize opportunities and leverage them, so that we as a state are maximizing federal investment here and putting our state dollars, making our state dollars go even further. Any other final thoughts or questions before we close out?
Alex, I'm not seeing anything else in the queue, and I'm just triple checking here, making sure I don't see any other hands raised, and I don't think so. So with that, we want to thank you so much for your presentation. I think a lot of great information was shared, and certainly learned a lot about the new features in FFPSA, particularly as it relates to children birth to 5. For all the participants on the line, I think you know how to get in touch with us. If you have any follow-up questions, we welcome that. And just as a reminder, there will be an evaluation that comes out, just a few questions. There's no more than 5 questions for you to tell us how the webinar went, because we're always looking to improve the quality of our content. So again, Alex, thank you so much for your information, and thank you, participants. Have a great afternoon.
Thanks, everybody.